even if it's been going on for a long time. I like what you said about we don't know.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronski, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. So, Dr. Mills, talk to us about before and after prostate cancer treatment, and we can talk about radiation and expectations around that and tissue changes, and also prostate removal and anatomical changes. So what should men expect?
Yeah, so I talk with guys a lot about how leading up to, usually when a guy's leading up to either making the decision between radiation or prostatectomy, it's been a minute of dealing with symptoms. Usually it's fairly common that they will have an enlarged prostate for a certain period of time, or they will be told that they have an enlarged prostate. And then this is why you've had all of these urinary issues. I find that a lot of those things are habit-based, that they pick things up over the years. They decrease their efficiency when they're urinating, and they pick up these things that they carry over with them either post-surgical or when they have radiation. So I'm very big on habits. I'm very big on hydration, either setting that up to make positive changes before surgery. So we're increasing bladder efficiency and capacity. A lot of the guys that I treat that have had chronic incontinence, it's almost like they have these little baby bladders that can't tolerate more than 30 or 45 minutes before they have this super strong urge to rush to the bathroom. And that's not correct, right? We should be able to hold it for 2 to 4 hours, if we need to, more than 4 hours. So anatomical changes when having the surgery, you're going to have your prostate removed, right? There's things that come with that. There's this big inflammatory response after a surgery, just like with any surgery. And we know that inflammation decreases muscle use. It's inhibitory. There's nerve damage, even if you're having a nerve sparing surgery. So we need to be gentle to those tissues down there. And when it comes to setting expectations, it's pretty normal for the first few weeks. Like, you haven't been moving all that much. You've had a catheter. It's pretty common to have a large amount of leakage in the first 3 to 4 weeks once you get your catheter out. You've had your prostate removed. In that prostate, you've had a sphincter, which is basically a valve that keeps the pee chute closed. One of my patients in the past said, whenever I feel leakage, the horse is out the barn. And I use that all the time now, because it's like, we got to keep the horse in the barn. Like, if you already feel like it's out, then it's too late, and it's past the valve that you still have, which is the external urethral sphincter, and the rest of the muscles on the front side of your pelvic floor. So we need to learn how to utilize those. We need to learn how to manage your pressure, because any kind of downward force on top of the bladder, you're taking the path of least resistance right now. And right now, because you just had surgery or because you've had radiation, your pelvic floor muscles are, that hole in the armor, right? And it's going to take the path of least resistance, and that's going to look like incontinence.
Let's talk about sexual function and why that might be different and distressing for someone who's gone through prostate cancer treatment.
Yeah. So should we start with like what the initial looks like.
That would
Okay.
start.
Okay. So it's pretty common. I feel like you could kind of put in most of the guys following prostatectomy surgery into two buckets, where there's guys that they feel like there's nothing there. And it's like they just say that their erections are dead. Like there's nothing, they don't have a whole lot of sensation. Then there's guys that have a little bit, they still have a certain amount of arousal. They're more exploratory, and they're doing things to increase their arousal, whether it's exploration in the shower, whether it's their partner is still interested in sex. So they may not be having penetrative sex, but they're still fooling around, and, taking those two paths, it's like, okay, well, even if there isn't a whole lot of sensation, we still want to do things to stimulate, right? A very easy way to do that is getting on Viagra, Cialis, or daily Cialis to encourage blood flow down there. I always talk to guys about how it's like, okay, well, right now your body can't do this on its own, so it needs a little bit of help.
Mhm.
So more help is better. On the front end, when things are more leaky, usually I'm not encouraging initiation of penis pump use until 4 to 6 weeks after the catheter, just because it can be a mess. And whenever they're going through the initial phases of learning how to keep the horse in the barn, I don't want to add too much complexity, but I'm pro starting to use the penis pump as soon as possible. Now, given the context of a lot of people that I treat, we talked about the chronicity of a lot of these guys. I get way better results with earlier engagement in therapy, right? But I hear I don't want to say horror stories, but like I hear sad stories all day about how long this has been going on, and how they only thought that, it was just going to get better, and they were going to do Kegels. They were going to do Kegels all day, sitting in a chair. And there was just going to be this magical bridge of incontinent to fully continent that was formed by doing, a squeeze that usually they don't do correctly anyway, because they were taught on a sheet from 1997 to do it, right? And it was going to get better. And there was not a lot of depth to the instruction, right? So in that lack of depth, usually they've been given a penis pump, but they were just given the penis pump and said, here, read the instructions. Don't leave it on for more than 20 minutes or it might fall off, and use it a lot. And that's it. There's no homework. There's no gradual build. There's no talks about how to use it the most effectively and why you should be using it to be effective. And, I like to boil it down to a blood flow issue. The more blood flow we can encourage to those tissues, the better. Under normal circumstances, if you haven't had, prostatectomy or prostate radiation, having an erection a day is a very healthy thing. We make the joke, an erection a day keeps the doctor away, right? So under normal circumstances, and then more research is being found that there's a lot of just general mortality statistics and vitality as a measure of having an erection. So we want there to be erections, and doing things to encourage that in the context of your body might not be able to do it its best right now. So we are going to do as many things to encourage that as possible, really is going to have the best results in the long run.
Exactly. And as far as what folks can expect, knowing that your general population is coming to see you several years or several months later, if things are not necessarily working as they should in that time, it sounds to me that just going through this process, that your body can change and that you can optimize your function. We may not know how much, to what degree or extent, but there's room for improvement.
Absolutely.
Like with neuropraxia after or nerve injury or irritation after such a surgery, if it was spared, that can take up to, the literature says, what, 2 years?
Yeah, 1.5 to 2 years. Yeah. I don't know if all physical therapists say this, but in PT school, I learned the mantra, a millimeter a day or a centimeter a month when it comes to neuropraxia. So, the conversation with most guys is like, most come in knowing that it could take 1.5 to 2 years. And it's one of those things where it's like, the idea of not having a process, not having a rehab process is, well, I'm just hoping it'll get better by then. And it's a very, like, I call it the possum approach. It's like lay on the ground and play dead until enough time passes that it might get better. That's not very proactive, right? That's not utilizing knowledge and science that we have at our use today. And the body is wildly adaptable, even if it's been going on for a long time. I like what you said about we don't know until we try, right? I use that conversation in the habit forming process of, unless you were utilizing positive habits, like, not being chronically dehydrated, knowing how to stick to a bladder schedule, create a bladder schedule, and track progress, we don't know how good it's going to get or how much positive changes are going to happen until we start to optimize those things. So until we have optimized those things, if you've just been, doing the possum thing, you haven't been, and that's typically no fault of a patient. It's usually the whole system not encouraging a proactive approach. And that's a big part of what I'm trying to trailblaze in the sphere of, like, there is a process, there's a research-backed process, there's a results-based process, and we could do that as long as, the typical curveball in this is, if there's no sensation, it makes things tough. But if there is sensation, even if it's not sensation, so when I say sensation, I mean sensation of the genitals, and then sensation that there's incontinence occurring, that the horse is out of the barn. If sensation is intact to a certain degree, there's, a typical process of, there's going to be progress. Radiation tends to make that a little bit more of a problem. Those are the more ups and downs patients that I've experienced, because radiation does tend to affect the nerves a little bit more than a nerve sparing surgery. But there's always a chance that if you optimize your habits, learn how to manage your pressure in your abdomen, and learn how to do a coordinated Kegel, things are going to get better. And then you do that over the course of learning how to put it together with every part of your day, right? It's all application at that point.
Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.